Billings is being considered as a potential location for a new state mental health facility in eastern Montana, a move that has sparked a range of reactions and questions from local officials and residents alike. Imagine a new chapter in mental health care unfolding right in your backyard. This isn't just a hypothetical. It's a real possibility in Billings, as the city finds itself on the shortlist for a much-needed mental health facility. The current state hospital in Warm Springs is struggling with capacity issues, prompting the 2025 legislature to allocate a substantial $26.5 million for the construction of a new facility. One of the prime locations under consideration is a piece of state-owned land on Skyview Drive, nestled between High Sierra Boulevard and Alkali Creek Road. Commissioner Mark Morse, who is part of a group that toured the potential sites, pointed out, "This was the last of the 5 sites we visited that afternoon, and it's situated near the High Sierra Dog Park." However, the proposal has not been without its controversies. But here's where it gets controversial. Billings Deputy Mayor Mike Boyett raised a critical point. Were we asked if we wanted this here? No, we were told. The state is going to build a building. This top-down approach has left many with a host of unanswered questions. Boyett and Morse, both of whom participated in the site tours, are seeking clarity on several key points. What exactly will be built? How many beds will the facility have? How many jobs will it create? Boyett highlighted that the Montana Department of Public Health and Human Services and the Board of Investments are particularly interested in Billings for several practical reasons. They want access to city water and sewer systems, proximity to the jail, and nearby hospitals. Essentially, they want to be close to the urban center, if not within Billings itself. Morse, however, questioned the necessity of such close ties to existing medical facilities. If they're the state hospital, why do they need Billings Clinic or St. Vincent's? According to Senate Bill 5, the state has until June 2026 to break ground on the new mental health facility. State Senator John Esp, R. Big Timber, anticipates that detailed plans for the project will be unveiled soon. One of the primary concerns for Boyett is the staffing of the facility. "My first question to the state was, how are you going to staff this?" he said. "There's a significant shortage of mental health professionals, and attracting and retaining staff will be a major challenge." Despite the uncertainties, Boyett remains open to the idea. Ultimately, would we like to have something like this for our part of the country? Sure, why wouldn't we? But there's a lot of questions that haven't been answered, and that's my main concern. And this is the part most people miss. The decision to locate a mental health facility in Billings could have far-reaching implications for the community, both positive and negative. While it could bring much-needed resources and jobs, it also raises important questions about community input and the potential impact on local infrastructure. What do you think? Should Billings welcome a new state mental health facility, or should the state reconsider its approach? Share your thoughts in the comments below.